Imagine you see your cat approaching its water bowl one morning. It drinks and drinks again. Something inside you ignites, a feeling you can't ignore. Cats can't tell us. It hurts. And when their kidneys begin to fail, silence becomes their worst enemy. What's most alarming is that 8 out of 10 cats will develop kidney problems at some point in their lives, and by the time we realize it, they're usually already advanced. That's why you need to hear this information today. You'll learn to detect the hidden signs, the silent risks, and the actions that can save your feline companion's life. Let's begin. 1. High-risk breeds. While any cat can develop kidney disease, some breeds are born with a genetic predisposition that significantly increases the risk. This doesn't mean they will definitely get the disease, but it does mean they require closer monitoring. Breeds such as the Persian, Siamese, Ragdoll, Russian Blue, Burmese, Maine Coon, Abyssinian, and their mixes are more likely to suffer from kidney problems throughout their lives. This is because many lines have a higher risk of developing structural abnormalities in the kidneys or more delicate kidney function. Therefore, if your cat belongs to one of these breeds, or is a mix of them, it's essential to have regular checkups, even from a young age. Ideally, annual tests should be done, and if necessary, every 6 months as your cat begins to age. Knowing about this predisposition isn't a cause for alarm, but rather a way to be proactive. Cats at risk can live long lives with an excellent quality of life, if we act in time. 2. Age, the most important factor. The passage of time affects everyone, including our cats. Although kidney disease can appear at any age, the highest incidence occurs from 7 or 8 years old, which is considered mature in a feline. From this stage onward, the kidneys begin to lose efficiency, even if the cat appears active and healthy on the outside. Many owners believe that as long as the cat continues to eat and play, it's fine. But kidney problems progress silently for months or even years. That's why experts recommend annual preventive checkups starting at age 7 and semi-annual checkups starting at age 10. Simple blood tests such as creatinine, SDMA, urine-specific gravity, and blood mineral levels can detect problems at such early stages that treatment can greatly slow the progression. An early diagnosis can mean more years of companionship, less pain, and an optimal quality of life. If your cat is already a young old man, this point is essential to protect him. 3. Diseases that increase kidney risk. Some health conditions predispose cats to faster kidney deterioration. One of the most common is periodontal disease, which involves excessive tartar buildup and chronic inflammation in the mouth. Bacteria can enter the bloodstream and affect vital organs, including the kidneys. Cats with diabetes, heart disease, or those infected with feline HIV or feline leukemia also face a higher risk. These diseases cause systemic inflammation, metabolic disturbances, and deterioration that directly affect kidney tissue. This doesn't mean a cat with these conditions is doomed. It means we must be more vigilant with monitoring, veterinary checkups, and hydration. Many cats with risk factors live long lives if the proper protocols are followed. The key is this: don't wait for symptoms to appear. If your cat has any of these conditions, preventative checkups are not optional. They are part of their basic care. 4. Toxins that damage the kidneys. Many homes contain plants, medications, and cleaning products that seem harmless but can be extremely dangerous for a cat's kidneys. One of the most serious cases is the lily, a very common flower in decorative arrangements. Any part of the plant, even the pollen, can cause acute kidney failure with just a small amount of contact or minimal ingestion. It is also crucial to be careful with human medications, such as ibuprofen, acetaminophen, naproxen, or similar painkillers. What is safe for us can be highly toxic to a cat. Even a very small dose, a chewed pill, or an accidental spill can cause serious and irreversible damage. Many ornamental plants, such as poinsettias, aloe, or Dieffenbachia, as well as concentrated cleaning products, also pose a significant risk. If you ever find a torn blister pack, an uprooted plant, or your cat vomits after possible exposure, don't wait. Taking him to the vet immediately can make the difference between a scare and a serious kidney emergency. 5. How to detect early signs of kidney disease. Most owners don't realize it until their cat is already in an advanced stage. That's why learning to detect early signs is vital. Cats with kidney problems often show frequent vomiting, loss of appetite, or unexplained weight loss. Their coat becomes dull and dirty, or the cat stops grooming itself with the same dedication. But the two most important signs are, first, increased thirst, and second, increased urination. A 4-kilogram cat that drinks more than a glass a day is consuming too much water, and that's a red flag. You should also observe if it urinates more frequently or leaves much larger puddles in the litter box. Something crucial: never ration water, thinking that this will reduce the symptoms. This only causes dehydration and worsens kidney damage. Recognizing these signs can save lives. If you notice any of them, don't wait. An early checkup makes all the difference. 6. The importance of daily hydration. A cat's kidneys depend heavily on proper hydration to function correctly. However, by nature, cats are poor drinkers. In the wild, they obtained most of their water from their prey, so their thirst instinct is weak. That's why we must make it easy for them to access water. Fountains, bowls in various areas of the house, clean, fresh water all day long. Any method that increases their consumption directly benefits kidney health. A very effective trick is to incorporate wet food at least once a day or every 2 or 3 days. Canned food provides between 70 and 80% water, which guarantees extra hydration without forcing them to drink. Cats that stay hydrated have much more efficient kidneys, and if they already have a predisposition or are elderly, this simple practice can delay the onset of kidney problems for years. Hydration is not a minor detail. It's a powerful preventative tool. 7. Proper nutrition and balanced diet. Diet is one of the most influential factors in kidney health. Some homemade or poorly formulated diets have an excess of protein, too much phosphorus, or too little potassium, which can damage the kidneys over time. Ideally, use high-quality commercial diets created with the appropriate nutritional profile for felines. If you choose to feed a homemade diet, it should be under the supervision of a veterinary nutritionist, never improvised. Even with good food, it's important to avoid being overweight. Obese cats have a higher risk of developing diabetes, which in turn damages the kidneys. This means that controlling portions, avoiding excessive treats, and promoting exercise are key decisions for protecting their kidney health. A proper diet not only nourishes, but also prevents. 8. The dangers of overweight and lack of exercise. Many owners think a chubby cat is a happy cat, but being overweight is one of the most silent and dangerous factors for kidney health. Excess fat generates internal inflammation and can cause insulin resistance, which can lead to diabetes. Diabetic cats have a much higher probability of developing kidney disease during their lifetime. That's why keeping your cat at a healthy weight isn't about aesthetics, it's about health. Interactive games, scratching posts, play structures, and short daily play sessions are enough to activate their metabolism and help their body function better. If a cat prone to weight gain eats too much or receives uncontrolled treats, the kidneys will be one of the first organs to suffer the consequences. And remember, prevention is always easier than treatment. 9. Never self-medicate your cat. The intention may be good, but the result can be tragic. Common medications like ibuprofen, acetaminophen, or even human antibiotics can severely damage a cat's kidneys. Their metabolism is completely different from ours, and what is safe for us can be highly toxic to them. Even a quarter of a pill can cause harm. That's why the only safe medications are those prescribed by a veterinarian with the exact dosage for that particular cat. If a veterinarian prescribes acetaminophen or a specific pain reliever, it's because they understand the cat's physiology and know the correct dosage. At home, no medication should be given just because it seems to hurt. Self-medication is one of the most frequent causes of acute kidney damage. If you want to protect your cat, this rule is simple. Don't give them anything that doesn't come directly from their veterinarian. 10. Preventive checkups, the key to extending their life. Veterinary checkups aren't a luxury, they're a tool for gaining time. Blood and urine tests can detect abnormalities at such early stages that they can still be stopped or slowed down. If your cat is a breed predisposed to kidney disease, is already a senior, or has shown warning signs, checkups should be annual or even semi-annual. Early detection can add years to your cat's life and prevent unnecessary suffering. Furthermore, these checkups allow for dietary adjustments, weight monitoring, assessment of vital organ function, and intervention before irreversible damage occurs. Kidney health is often silent, but checkups break that silence and allow us to protect your cat in time. Caring for your cat is a responsibility, but it's also an act of love. If this topic concerns you and you want to give your cat the long and healthy life they deserve, you can't miss the video playing on your screen. There, you'll discover 8 dangerous myths that many owners unknowingly believe and which are silently shortening the lives of millions of cats. If you truly love your feline companion and want them to live more than 20 years, watch that video right now. You'll be surprised how much things can change with the right information. If you've made it this far, it's because you truly love your cat and want to give them the longest and healthiest life possible. Their kidneys work silently every day to keep their body in balance, but they are fragile, silent organs, easy to overlook. Caring for them is an act of love, and now you know the signs, risks, and actions that can make a huge difference to their well-being. Small changes, more fresh water, a good diet, preventative checkups can lengthen their life and prevent unnecessary suffering. And the best part is that every decision you make today can have a real impact on their future. Now I'd love to read your comments. What habits or behaviors of your cat have worried you in the past? Any signs that made you think something wasn't right? Sharing your experience can help many other caregivers who are going through the same thing. Like this video, share it with other cat lovers, and subscribe to keep learning how to give them the long, happy, and safe life they deserve.